episode of the Dr. Cliff Show. My name's Rachael Cook. I'm an audiologist at Applied Hearing Solutions in Phoenix, Arizona, and I'm joined today by my co-host.
Hi there, guys. My name is Kelsey Beck. I'm the audiology resident at Applied Hearing Solutions. And today we are going to be talking about all things professional earwax. We've got a really wonderful lineup today. So we're first going to review what is earwax, what is its purpose, and why do we need it, some problems that it can create. We're also going to now talk about how we can remove it professionally. If you're wondering more about some at-home methods, we did a podcast last week about at-home earwax removal. So after the end of today's episode, go back and check out that episode as well for all things at-home earwax removal. But we're going to talk about the different tools that we use in the clinic and when we might use those different tools, what type of earwax we would use them for, and then also when you should actually seek out professional care rather than attempting to do it at home as well. So make sure that you're asking your questions along the way. We do have our lovely Bree. She is an ASU graduate student in audiology as well, and she is monitoring our question section today, and she will be collecting those questions for our live Q&A at the end of the show all throughout the episode. So the second you have a question, stick it in the comment section. That way we can answer it live.
Right. All right, but before we jump in, we've got to start off with our first sponsor segment here. So at this point, I'm sure you've heard us talk again and again about the Sontro OTC hearing aids from Soundwave Hearing, and if not, here you go. So the Sontro is a receiver and canal design, and it's intended for adults with mild to moderate perceived hearing loss. It utilizes their Auto-Tune smartphone app, which allows you to test your hearing and uses artificial intelligence to customize your initial programming. The app will also let you make self-programming adjustments to your Sontro OTC hearing aids to help you optimize their performance. These adjustments include different programs, an equalizer, noise reduction, and feedback cancellation that you can adjust from the comfort of your own home. Not only that, but you also get 1 month free of auditory training from Amplify, which is a digital hearing health program that helps your brain process auditory information better. Personally, I am a huge fan of auditory training because it is absolutely one of the easiest ways to improve your performance with hearing aids. And if you'd like more information about the Soundwave Sontro OTC hearing aids, go to hearsoundwave.com. You can check out Dr. Olson's review video, Dr. Cliff YouTube channel, or check them out on our website, hearingup.com. So thank you, Soundwave. All right, if you were in our episode last week, then this is going to be a bit of a review episode for you. But for people who are joining us this week that weren't with us last week, we wanted to kind of review what the heck is earwax, where does it come from, why do we have it, just to lay some of the framework before we start getting into talking about how we professionally remove it in office.
So we're going to start off with our first graphic here. It's just the anatomy of the ear, and you'll be able to see on this graphic here there is a spot with the earwax that is pointed out in that outer portion of the ear canal there, and it is created in that outer third of the ear canal by sebaceous glands, and that's intended to moisturize the canal. And then you also have the cerumen, or the earwax glands, and that will also have the fatty acids, cholesterol, some alcohols as well, and that's also to make sure that all debris and dirt can all escape the ear canal. And it really does serve a purpose inside of your ear to make sure that it does stay healthy, it does stay clean. It also does provide lubrication and moisturization for the skin in there, and it also has a lot of antimicrobial properties as well to keep ear infections, so infections in the outer ear, away from you. That way you can have, a healthy ear long term. But it can also go into overdrive a little bit, so some people do produce more earwax than is ideal, because typically what you'll see is that earwax, as you chew and as you talk, that will start to migrate out of your ear canals, and then it is designed so that it will come out all by itself. But if there are people who do have especially twisty or bendy ear canals, outside of, the quote-unquote norm, it has a really hard time escaping all on its own, and that can create some earwax impactions. It can also create, just an overgrowth essentially of the earwax inside the canal.
Right. I even saw a patient this week who their issue wasn't necessarily that the amount of earwax was a problem, but it was really more the hair in the outer third of the ear canal, and that hair had been growing so thick and so voluminous in the ear that it was literally creating this kind of booby trap, if you will, for the wax. So it's not that the wax was over accumulating necessarily, it just couldn't get out. And so over time, as that builds up and builds up and builds up, that hair was not letting it get out of there. So there are other factors as well. Your age plays a big role in how much earwax you create. Genetics definitely play a big role, and your environment. So if you're living in an environment that is drier, you might have drier, flakier wax. If you're living in an environment that has more humidity, you might have stickier, thinner wax. It really does depend on your surroundings, on your genetics. I actually even pulled some interesting statistics for this episode as well, and about 10% of children at any given time have earwax that has nearly occluded or completely blocked off of their ear canal. Only about 5% of adults, but then about 57% of individuals living at assistive living facilities have occluding earwax, which is a huge number.
Huge number. That is far higher than I think I would have expected.
I know.
And I think I read somewhere as well that it is one of the most common procedures performed at ENT and PCP offices, so your primary care office, is actually cerumen or earwax removal, which I guess, thinking about it now, that does really kind of coincide with that 57% of those in assisted living. Man, that is such a high number.
It is.
Man.
It definitely is.
So if you do fall into that category of someone who does live in assisted living and you haven't had anybody look in your ears in a while, you could be part of that 57% who should really seek out a hearing healthcare provider, your audiologist, and to go and get that professionally removed. So let's talk a little bit about who can remove that earwax. So I already mentioned your primary care physician. Urgent care sometimes can also do earwax removal. I will say, though, that it's not really their specialty per se, especially at urgent care. So, and we've all seen a couple of horror stories, not horror stories, but, when people will come into our office, they'll say, oh, yeah, I just had a checkup with my primary care physician. They looked inside my ears. Nobody said anything was weird. And they've got full impactions.
Yeah, unfortunately. I do think that there's plenty of providers that are able to handle that and handle that well in their office. But it's definitely not their primary focus, right? So I have also seen individuals who said, yep, my doctor checked it out, everything looks good, and we look in there and we are like, not good, not even close to good.
I'm like, so, is there an eardrum in here?
I know, I can't even see in there. So, even just otoscopy, which is us just visualizing the outer ear canal, takes time to really learn that skill and dial it in well. I have a couple of friends who are also in the medical field that do otoscopy here and there, and they're like, I still have no clue what I'm looking at. And I'm like, well, that's a problem.
That is definitely a problem. Well, you know what, and I actually went to urgent care, not too long ago during my grad school career, and someone in urgent care looked inside my ears, and I'm like, I don't think you saw anything. Barely put the otoscope inside of my ear.
I remember you saying that.
Maybe spent 10 seconds on it, just kind of. I genuinely don't believe she saw anything worth anything in there. But in any case, so those people are able to remove earwax, especially if it's something that they do often, because I do know primary care physicians and urgent cares that do a good job of earwax removal. So that it's not that they don't exist, but it is something to make sure that you're asking about, how often are they doing it? How often are they seeing it? The other people that can do earwax removal sometimes are hearing instrument specialists. Now,
it's very rare that it falls into their scope of practice.
Very rare, and it's state by state, and again, I'm not even really familiar which states at this point do allow it, but a hearing instrument specialist is not an audiologist. They are someone who is, solely, their sole ability is to program and dispense hearing aids, and so earwax removal for the most part does not fall within their scope of practice, but there are states that do allow for it as well.
Now, ear, nose, and throat physicians are going to be the most popular medical providers that are doing earwax removal, especially professionally. Ear, nose, and throat physicians, obviously, it's part of their name, right? An ear physician. So they generally have all of the equipment necessary to do that. And we're going to be talking about professional earwax removal today in the form of instrumentation, like tools to help kind of pull wax out of there, suction equipment and also irrigation equipment. They oftentimes also have these really large industrial kind of microscopes that go right in front of their faces. They're able to look right in your ear and get really, really kind of tedious with that earwax removal. So they're definitely a popular option.
Oh, absolutely. And then the other popular option, I think, as well, is an audiologist.
Of
And
course.
perhaps I'm a bit biased, and I'll own that bias here. But it is something that we do on a daily basis. I'm actually pretty sure that every patient that I saw today, I pulled earwax out of their ears.
Yeah, we do a ton in our office, and it is important to note that not all audiologists actually do cerumen removal. A lot of it has to do with confidence in cerumen removal, so it's probably one of the only instances in audiology where we have the potential to maybe cause some discomfort for a patient. So some providers just choose not to do that, and that is okay. And the other part of that is a scope of practice thing as far as laws and regulations go. So again, state by state, it's going to vary on whether or not audiologists are allowed to be removing earwax in office.
And that being said as well, the ability to do earwax or cerumen removal at all was not always something that was in the scope of practice of audiologists either. And so that is something that has also been changing over time too. But in any case, our office in particular does have a lot of the tools, if not almost all of the tools. Because again, it is one of my most unexpected favorite parts of being in audiology. But that we do look for some very specific things when we are looking inside the ear and how we're choosing to remove that type of earwax. And some of that is, how often are we seeing somebody have this kind of a buildup? So how often are we actually having to remove that wax? And what type of wax is it? Really depends and dictates how we go about removing it.
Oh, definitely. So there are different kinds of wax that we find in the ears, different consistencies. Again, we were talking about environment playing a big role in that, age playing a big role in that, and genetics playing a big role in that. And so I guess I should take a moment here to throw out a quick caution. If you get queasy, if earwax isn't something that you want to see, if that's not if you're eating right now, you may want to avert your eyes, because we're going to start getting into pictures and videos here, and I just want to give everyone that kind of warning there. But the first graphic that we're going to throw up here is going to be more hard wax in the ear. And so we'll okay, that right there. All right, so we're looking in the ear. This is what we would consider to be a complete and total occlusion or impaction. This means that sound vibrations cannot get through that wax at all, which means this person is going to say, help me, my ear is clogged. I can't hear anything and I can't hear it well.
Yeah,
so
people definitely come into our offices saying, yep, I definitely have a hearing loss. It started 5 weeks ago.
Yeah.
Okay, let's take a deep dive onto that, and you look inside their ears, and that must have been the moment where we completely occluded the ear, where you noticed it the most.
Yep.
With that earwax.
But then we also have sticky earwax, so we've got a graphic of that one too. And so when we get this one pulled up here, you can see that the consistency of that really, really shiny, a lot of flashback on the camera here, really thin coating on kind of the perimeter of the canal walls. It looks like someone was already attempting to do some sort of cerumen removal in that ear, whether it was the patient or a provider, because we see a bit of an abrasion on that left-hand side. But that consistency of wax, the way that we would go about removing that wax is going to be completely different than the way we would go about removing the wax that we saw in the previous graphic.
Exactly. We're about to hop into our next sponsor segment, but honestly, if you guys already have questions, please put them into the comment section below. That way we're able to get to them when we do come to our live question and answer segment at the end of our show. But because it's most appropriate, I thought we would talk a little bit about Earwax MD from Eosera. Everybody does have a small amount of earwax inside of their ears, and in the proper quantities. Again, it is designed to help to moisturize and lubricate the ear canal. However, it can be helpful to do some at-home removal as well as seeking professional care. We want to make sure that the ear stays moisturized, it stays protected from dust and debris. And so we have Earwax MD that is designed to break down the earwax inside your ear. It has sodium and potassium bicarbonate to break down that earwax, glycolic acid to exfoliate those dead skin cells, and the glycerin to help hydrate the canals, and so that earwax has a good chance of working its way back out of the ear. You'll use 10 to 15 drops for 10 to 15 minutes. Once that's done sitting in there for 10 to 15 minutes, you'll actually use either the bulb syringe that comes in the box, or you can even hop in the shower, let the shower water run through and flush out those ears for you. You can visit eosera.com, or they're sold at the local CVS, Walgreens, Walmart, most other national retailers as well. So Earwax MD is something that we do use in the clinic often and regularly, so we love this particular product. I think even at the big audiology convention over the last weekend, they were even giving it out too. So definitely a product to keep at home for your back pocket.
Oh, definitely. And even though it is an over-the-counter product, like you were saying, we use this in the office a lot. In fact, I was just using this yesterday, and we often use it in tandem with professional removal, because oftentimes we do have patients come in that have had this hard, occluded, impacted wax in their ears that has been developing over months, potentially even years. And even with suction, even with irrigation, even with instrumentation, all the things we're about to jump into, if it is stuck in there, I know that we're the professionals, but sometimes we don't even stand a chance, and we need a little bit of assistance. We need something to get in there, lubricate, rehydrate that wax, really add in some sort of moisturization so that, or moisturizing properties so that we can get that wax to let go of the canal walls. And so I had to use it the other day, first on one side, then on the other side. Worked like a charm. I only had them put it in their ears for about 5 minutes after we had already used about 12 liters of water trying to get that flushed out. And after soaking both of the ears, easy breezy, came out within just a few minutes. So a product that we use in office, and you can get that process of softening up that earwax at home before you even come in to see us. So.
Oh, yeah. But when you do finally come in to see us, like we've been alluding to, we do have a number of tools that we will use at our disposal so we can actually get that earwax out of your ear and out of your ears safely.
Yes.
So the very first thing that we'll usually do is look inside your ears. We want to do otoscopy to make sure that we are actually visualizing the ear canal, if we can see the eardrum. That way we know exactly what we're working with. Then we'll also use, when we go into that cerumen removal process, we'll actually in our office use a little headlamp that actually lights up the ear canal, and it allows us to go ahead and zoom in with some really good depth perception. What's the word?
Magnification. It's got little magnifying glasses on there.
And it gives you good depth perception as well, so we can see exactly what we're doing, because we are placing foreign objects inside the ear canal, and we want to make sure that we have the best visualization that we can while we're actually removing that earwax.
Yeah, it's key. And we generally start this process off with some sort of instrumentation. And when I say instrumentation, what I really mean is we're just using instruments, tools, handheld tools to try to remove this earwax, or at least get a feel for what the consistency is. Is it going to put up a fight? Is it softer? What are we working with here? So one of the tools that we use most often in the office is just a simple curette. And a curette is a small tool with a little loop on the end of it that allows us to go in and kind of scoop it out. And there was this viral video that went out. I can't remember if this was Vice or which company did one of these videos, but this individual went into the office to get that earwax removed. And although her face looks like she's in pain, she was more in shock because she was looking at the amount of earwax in her ear. So this doctor is actually holding a camera in his left hand and a curette in his right hand, using the camera to visualize the wax and using the curette to actually pull it out. But really, she was more just disgusted at the earwax. I promise she's not in that much pain.
Exactly. And so when we're doing the curette, again, we sometimes are able to remove it just with the curette, depending on the amount, depending on that consistency. But sometimes we'll even put the curette in there, and we're not getting a good grip on the earwax itself. And so in order to get a slightly better grip, there is a different tool called alligator forceps, which are they look a little bit like scissors, actually, but they're not. They're little pinchers, little grabbers that open and close, and that will actually allow us to go ahead and go into the ear canal, quite literally grab it and pull it back out. It's very precise, and you have to have really steady hands with this particular type of tool. You really don't want to touch the sides of the ear canal with this particular tool. We want to make sure that we're causing minimal discomfort.
Right.
But there are some cons to a tool like this as well. And again, The removal heavily depends upon the professional that is doing it. So not all professionals are comfortable using alligator forceps, which is a-okay. They might be more comfortable with a different type of tool. But you may not be able to get every single piece of the earwax out depending on that consistency.
For sure.
And it can also cause some discomfort if this particular type of earwax is really adhered to the canal wall, because it really is essentially pulling it right off the canal wall. You can sometimes cause some abrasions. You can also sometimes, take off some of the dead and dry skin as well, which can cause some discomfort.
Yeah, once we go past that first third portion of the ear canal, the rest of that tissue or skin inside of your ear canal is sitting directly on bone, and it's thinner than tissue paper. So it is really easy to cause abrasions. Your ear canal is sensitive on purpose. Your ears don't want you sticking things in there and don't want you poking around. So there are a lot of nerve endings that are in there to keep you out of your own ears. Now, there's no way for us to tell our ears, hey, this is a professional. We don't have to be super sensitive right now. So that is one of the downfalls of using instrumentation, is just depending on the consistency, depending on how long it's been building up in there, there is the potential for some discomfort if it has kind of adhered to that wall in there. But then we move into, okay, so we've used the tools, we've tried to get out as much as we can, and maybe we're kind of at a standstill, or maybe we're working with that stickier wax where no matter what we use, a curette, forceps, we just can't get a grip on it. It's just too thin. And at that point, we need to switch over to suction removal.
And suction removal may be one of my absolute favorites.
It's pretty fun.
It essentially uses a pressurized vacuum to remove that wax, and it's really good, again, for that thinner, stickier wax. It can really hold on to larger pieces, and really, especially with that stickier wax, it can even like slurp it up essentially to really remove all of that wax from inside the ear. You can see in this picture here, he is still, this particular provider is using the headlamp so that he has good visualization while he is removing this sticky wax. But you can see the suction in his right hand there, and that tubing actually connects to basically the like a tub of water essentially that all of that wax is then pulled into, and it can get a little icky inside there. We actually cleaned ours today. So.
Yes, we did. I think we've got a video of this too, a suction video here, and I definitely want to play this if we can, because that video is awesome when you're watching all of that earwax kind of get suctioned out of the ear there. All right, he's going in. Okay. Oh, this might be the tool.
Oh, that's the curette video.
Oh, yeah. We needed to show that one for the previous one anyway. All right, so this is the tool that they're using to grab onto that wax and pull it out of their ears. They're actually not even using a curette for this one. It's more kind of a pick type of a tool. But, man, look at how satisfying that is to get that all out of there. Holy moly. That person had a lot. And look at that eardrum. Ta-da!
Nice and healthy.
Perfect. Now, here's the suction.
Is the suction tool.
All right, here we go. Oh, no, I'm looking at our other producer, Jeff, over there, and his face does not look happy to be seeing this video. That you can tell we've got that little vacuum going in there, and that is grabbing and gripping onto that wax and really just pulling it on out. Sometimes we've really got to kind of wiggle it around, move it around. Depending on how long it's been in there, it often puts up a fight. So we have to put up a fight right back to get it out of there.
Oh, but that was so satisfying. You got a really big
I
piece
know,
out there.
I know.
Going
It's
back
great.
in for some more
Going
right
back
in here.
for more. Gosh, so effective. So I do agree. Suction, I used to be scared of it, really just because, you're putting a vacuum in someone's ear, and I didn't know if I wanted that power necessarily. And then I did it about 2 times, and I was like, this is so effective.
It's so
I could
easy
go in
to.
and clean the canal out just to where the point that it was absolutely sparkling.
Absolutely. And the other downfall to it as well is that it is really loud.
It is loud.
And
It's
so
loud.
if you are sensitive to loud noises, it might not be the best if you have tinnitus. It also might not be the best particular tool for you, because we want to make sure that we're not also giving you any adverse auditory perceptions with it either. We don't want to aggravate your tinnitus. We don't want to aggravate your hyperacusis. But again, it does give us a really good and clean ear canal. And so when we can use it, when it's appropriate, it is a really great tool to have, again, in your back pocket, or I guess in the other room as a little wheelie cart. You know?
Yeah. Oh, definitely. And we're about to jump into irrigation here, but this is really a great tool if you have a history of, let's say, outer ear canal infections, like swimmer's ear or something like that, where we don't really want to be introducing water into the outer ear. Similarly, if you have a history of or currently have a perforation in your eardrum where you have a hole, we cannot be putting a bunch of water into that ear. So suction allows us to continue to do some wax removal without any concern of introducing water into that middle ear space or even into that outer ear space and causing any potential infections or anything. Only if you're susceptible to it. Most people don't have issues with irrigation, but.
Absolutely. And so since we've alluded now to irrigation, let's hop right on into irrigation. So there are several tools that actually allow us to irrigate your ears and really pull that wax off of the canal walls. And the first we have is a syringe. Now, a syringe, I think most people think of like with a needle on the end. This one does not have a needle on the end. It really just has enough, a space to have the water go into the syringe, and then you really just squeeze that syringe and allows the water to come out of the tip. And really the technique to using something like this is also, again, a circular motion, because really the goal with something like this is to go around the edges of the ear canal to really make it come off and let go of the ear canal. That way it can slide out either potentially with the water, or if we have to go back in with, something like a suction as well.
Right. Then some offices also use like more squirt bottle type of a thing. So we've got a graphic for this one too. On these ones, you can see there's a little tip that goes into the ear. Same type of a thing, except you have a little bit more water that you can use, so you can keep going for a longer period of time rather than trying to refill that syringe over and over and over again. And you can see there's a little catch basin there that's held underneath your ear as they're doing that to catch all of the water and debris that may be falling out. Now, there are also some electronic flushing tools on the market. There are different companies that put out products that do some pressurized water. The basins that I've seen on those, they don't hold a ton of water, so you can flush for a minute, maybe, before you got to refill again. So maybe not the most effective. The most effective, hands down, from a professional standpoint, is going to be what we use in office, which is our irrigator,
which
no pun intended.
It actually is my favorite pun in all of audiology, because it quite literally is an irrigator that is called E-A-R, regator.
Irrigator, yep.
And it essentially houses a lot of water, and it allows us to actually have this pressurized, essentially it looks like a gun a little bit.
Yeah, it does.
But it allows us to control how much water pressure, so we can vary the pressure depending upon your tolerance and actually how stubborn that wax might be. And again, it allows us to go just around the outside of the ear canal in order to get it out. And actually, we have a really great video of our very own Dr. Balderas performing it in office as well.
All right, so you can see she's got that irrigator all lined up. The patient's got that little catch basin right there. She's got her headlamp on. She's ready to go.
And just as a clarification, we did have permission from this particular individual to be able to use this video and to be able to film as well.
Great. So you can see that water stream is starting now, and you can see she's kind of doing these small little circular movements, really trying to get around the outside of that earwax. This person had quite the impaction in their ear, so just going low and slow. That water's flowing the entire time. It is temperature controlled as well. We don't want to do or use any sort of water that's too hot or too cold, because that could make you really, really dizzy. Oh, and there it is.
Look at that plug.
Wow.
And then we also went and did this person's other ear as well, and it was equally as impacted.
Gosh.
Honestly, it was one of the best, I think it was on a Friday, so one of the best, most interesting Fridays we've had in quite a while, because that particular day, I think we had like back-to-back irrigation, cerumen or earwax removal.
Last week for me, I'm not going to lie, I probably did about 5 sets of ears just like that. And even yesterday, I ended up, so that basin, that water basin at the bottom of the irrigator holds about 4 liters of water. I ended up using 16 liters of water on this individual.
Wow,
so we did round after round after round after round. This is the same individual who then, after the first round of 4 liters and 4 liters on each side, we used some of the Earwax MD to soften that up for the next few minutes, went back in, kept going for it, and we were finally successful. 2 clear canals, beautiful eardrums, no pain, no discomfort. And then we got to the point where we were like, okay, I'm going to be seeing you every 6 months from here on out. And we're going to get you on a proactive earwax removal schedule rather than letting it get to this point again, because at this point, this person literally could not hear out of their ears because they were that clogged up.
Yeah, and that's the thing too, is that like it really does create a substantial hearing loss when you do not have it well managed. And I think too, I mean, everybody says, oh yeah, like, okay, I used cotton swabs or Q-tips or what have you, and I, always feel like I'm getting earwax out. Like, how do I know when this is a problem? Firstly, you'll know when it's a problem because someone will have, I hope, someone will have told you at some point, whether it's your primary care physician, if you did go into an ENT at any point in time, they're like, this is quite a bit of earwax. But if you haven't had it checked out in a while, you feel like you're all plugged up, you feel like your ears are constantly itchy, go and see that professional because they can look inside your ears. And if you're someone who needs to be on an earwax removal schedule, they will put you on a removal schedule because we really don't want it to get to the point where it's going to cause an issue.
Nope. We want to be proactive in this regard, and we have plenty of patients at our practice that we are doing consistent earwax removal on. So the pros of irrigation in office are going to be that it's generally comfortable. It's really, really effective with harder wax, those kinds that look like absolute plugs that come out of there. And there's really minimal concern of causing too much damage to the ear canal structures or anything like that. We're not using any pointy tools. We're literally just using water.
Absolutely.
But there are some downsides to irrigation as well. So again, I talked about temperature playing a really big role in the comfort of that experience. If the water's too hot, water's too cold, it might not feel good in your ear, and it also might cause some dizziness. So it's really important that you're using body temperature water when you're doing this. You cannot have this done, as I said earlier, if you have a history of an eardrum perforation. We do not want any of that water or any of that debris getting into the middle ear space. That can definitely heighten the risk of middle ear infections at that point. The control of the pressure determines just how comfortable the experience is. This is definitely why we like using the irrigator in office and having that pressure control. When you're using any sort of syringes or anything like that, you may not have as much control over the pressure. So
it's
there's
definitely
the potential,
not as precise.
Yeah, there's potential for some discomfort there. And if you have a history of external ear infections or outer ear infections, it's really important that you get the ears dry after having this completed. So we now have an ear dryer in office that
which has been such a hit. It looks like a little flip phone. It's really cool.
It's like a hair dryer for your ear canal.
It's really an interesting sensation as well because I did try it out after someone irrigated my ears, and it's an interesting sensation. I'll leave it at that. So if you want to have irrigation done on your ears, make sure you see your hearing care professional and ask them about an ear dryer for when you're done.
Right. And any open abrasions as well. So if you have any sort of cuts or nicks, a lot of times we look in people's ears before they come to see us. They try desperately to get the wax out of their ears with cotton swabs and things like that. They weren't very successful, and we look in the ear canal. There's blood, there's abrasions, things like that. That's not an ear canal that I'm going to feel comfortable doing irrigation on, just because anytime you have an open wound or an open abrasion, I don't want to be taking earwax and getting it all into that open abrasion. We're going to let that heal up first, and then we'll get you back in to remove the rest of that. So.
Absolutely. And so if you are curious about having earwax removal done professionally, it is always very important, no matter what you're doing with your ears, hearing loss related, earwax related, that you're finding a provider who follows comprehensive best practices. Now, Dr. Olson has done us a great kindness in starting hearingup.com, and there is a finder provider tool on that website where you can actually type in your zip code or your address, and it will find you a provider in your area as close as we can find you a provider. We are in the United States. I believe we're also in Canada as well.
Or expanding to it at least.
So please use that provider on hearingup.com. And if you have any other questions, you can always go and use that Find a Provider tool to make sure that the person that you are going to be seeing for your earwax removal and other hearing care that you require will be following best practices.
Yes. So we're going to do a quick summary here of just really who is the best candidate for professional earwax removal, and then we're going to be jumping straight into the Q&A segment here. But the first candidate that I think of is if you have a history of earwax buildup that is just not well managed at home. If you're constantly running into issues, you're with your spouse, you're in the bathroom leaning over the sink and just getting water all over yourselves. It's a messy process. It's an uncomfortable process, and nothing's coming out, and it just turns into a fight more than anything. That means that you're probably not managing your earwax well at home yourself, and you're going to be better off in the hands of a professional.
Exactly. And two, if you've tried to attempt earwax removal at home and you don't feel like you've gotten enough of the earwax out, or you feel like there's still some in there, going to your hearing care professional, going to an audiologist or an ENT even, to get that professionally removed will be a really good idea for you. In addition, you can also cause pain and discomfort you can cause pain and discomfort by trying to remove it at home, but also the nature of having too much earwax or even a full occlusion in your ear can cause pain, discomfort, itchiness, even pressure inside your ears. It can even cause ringing in your ears as well, because all of that sound that travels up your jawbone when you talk as well just gets trapped in there and starts rattling around inside your ears. So you want to make sure that if you have any of those symptoms, you're also seeking out the care of a hearing care professional to have it professionally removed.
I will say, if your earwax accumulation gets to the point of a complete and total occlusion, you're definitely gonna have an uphill battle in being successful in removing that at home yourself. I think it is very easy to have good at-home management strategies in place for earwax that has not developed to the point of a complete and total occlusion. But once you hit that point, I mean, I just told you, I spent 16 liters of water on this individual. We did 2 rounds of soaking with Earwax MD. We were using suction. I mean, we did everything in that appointment, and that was with me having a perfect view of the ear canal and knowing exactly what I'm doing with all of the tools at my disposal. So had he attempted to do that at home, not a chance.
I mean, he probably could have used a chisel and it still probably wouldn't have
come out. Yeah.
Also, don't use a chisel on
Don't
your
do
ears.
that.
Is
This
not
is
a
not
that's
medical
not a real
advice.
recommendation at all.
No. But again, like we said earlier, if you have a history of outer ear infections or with an eardrum perforation, you are not a candidate to be doing at-home earwax removal. You really need to be seeing a professional for that. I will also make the suggestion that children are not great individuals to be doing at-home earwax removal on. They make very rapid movements. That's a problem because, again, we've got very, very delicate structures within the ear canal and the eardrum that we do not want to be damaging. They generally are more sensitive to any sort of pain or discomfort. It's really best if you have kids that you feel have earwax impactions, get them to see a professional, please.
The other piece to that too is their ear canals are absurdly
So
small.
tiny.
Absurdly small. And I mean, they even make, they say, oh, I make cotton swabs for kids in your ears.
No.
Don't go putting them in their ears. They are too big. You will just push that earwax further into their canal. I guarantee it.
Don't do it. Don't do it.
But you can also prepare, though, when you are going to a hearing care professional, prepare to have that earwax removal done, especially if you're someone who does it on a regular basis as well. Earwax MD, for example, is a great thing to have at home before going into your hearing care professional so that you've already softened up that wax, especially for someone who does have impactions like this particular individual. We've even sent people home if we cannot review, if we cannot remove the wax in the office. We'll send them home with some Earwax MD to be utilizing during that next week, and then the next week we'll be able to bring them back in and we're able to flush or suction out that earwax because it's softened up so much over time.
Yeah, the patient that I just saw this week that I got set up to come back in 6 months for just proactive removal, he already has Earwax MD at home, and I said, listen, you're going to put the drops in your ear, you're going to lay on your side 5 to 10 minutes, let them soak, and I want you doing that at least 2 days before you come into your appointment. That way we can just be really, really effective with our time in these appointments. There's less pain, there's less discomfort, everything's broken up, ready to go, so I can just flush it out.
Exactly.
All right, well,
I think it's time for questions.
I think it's time for questions. So we are joined by our lovely question assistant here, Bree.
I have to share your microphone.
Oh,
today.
cool.
Oh, yeah.
Not a problem. Here we go.
Sharing is caring.
Yep.
Jinx.
Perfect.
Happy to be back again today. So we didn't have a lot of questions. I guess people were more interested in removing wax at home, but we had a couple.
That's okay.
That's fair.
Yeah. So the first one is from Mona Hippolyte, and she says, can earwax buildup be related to an underlying health issue? If you find yourself constantly having to go to the doctor to get your earwax removed, can that be related to something else?
I'd like to think yes. Just knowing what we know about what earwax is comprised of when we talk about those fatty acids, cholesterols, body alcohols, things like that. If there's something that's causing an imbalance in one of those 3 categories, then you may find yourself producing much more earwax than the average individual. I like to think that genetics, age, and environment play more of a role on that. I can't think of any disorders or anything at the moment that have much higher rates of earwax accumulation. I know that there are disorders that cause smaller ear canal shapes and sizes, and that can make earwax removal harder, right? But I don't think so.
I don't think so that either. I don't think I'm aware of those either. However, I am aware that there are medications that can actually alter the color of your earwax, because there are, and there are some, because what they'll do is they actually alter the color of like your sweat, from your sweat glands and other body fluids as well. So, I mean, I do know of a patient who they come in with their hearing aids and their domes are always turned red.
Yeah, the pink ones.
Yeah, the pink ones. And so you can always tell when this particular set of hearing aids comes into the back office for cleaning, because they are discolored because of the type of medication that he does take.
Okay.
And it does also alter the coloring of his earwax as well. But as far as an overproduction, I'm not at the moment familiar, but we will do some more research onto that as well. And if there is any other correlations, we will make sure that we post that comment on this video as well.
The only one that I know of is Down syndrome. Individuals with Down syndrome do have higher rates of earwax impaction, but it could be due to the smaller ear canals.
Correct.
Yeah. It's a question of, is it more like anatomy than actual production issues there?
It's
But
chicken and egg kind of
but
thing.
right,
Exactly.
good question.
All right, so our other question was by Lee Stoll, and he says, I was told that I have a lot of hair in my ears. Should I use a trimmer in them?
Well, all right. So anytime that we're introducing any sort of sharp objects into the ear canal, I have a little bit of concerns there. A lot of individuals have hair that kind of grows right here, right at the opening of the ear canal. And do I think that it is best removed by someone else, someone that has a better view of your ear? Absolutely, because, sharp objects, ear canal, not my favorite type of situation. I know a lot of barbers or individuals that work at hair salons will go in there with a trimmer. I've even seen some videos where they're even waxing the outer ear canal. I don't necessarily know how comfortable that would be, or if I'm going to endorse that very seriously, but I do think that it can be trimmed and trimmed safely. It should just be done by someone who's a professional in trimming hair, so some sort of barber if you can. Yeah,
Maybe that's a service we should offer.
I think we talked about it in a team training.
You know what? I
once.
think we did.
We were joking about it, but
hey.
yeah. I with the individual that I saw this week, it would have likely been to his benefit to have that hair trimmed every once in a while, because it was really just acting almost like barbed wire. Like it was just keeping that wax in there, and that wax really could not migrate out of the ear. So, yes and no. If you are going to have it trimmed by someone that can see in your ear. So that is absolutely not you. It's going to be somebody else, and it's going to be somebody else that has the tools to do that effectively and safely. And I am not endorsing ear waxing. Ear waxing. Waxing of the ears.
We're just full
I've
of
said
fun.
earwax too many times today, but don't go get an ear wax.
I mean, I guess you don't want to put your wax in your ears either.
Yeah.
So.
No wax for the ears in your ears.
Period.
Yeah.
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 All right, you guys. Well, thank you guys again so much for joining us for our live show. We will be back again next week, but we are starting our bonus series, and we're going to be talking for the next 6 weeks all about the different instruments that we use in the clinic to not only test your hearing, and then how we're going to use that all to interpret results as well. So stay tuned for our bonus series over the next 6 weeks. You can find that on YouTube, Facebook Live, and WTSMTV.com.
Yes. And we'll see you back next week with the Natus bonus series.